Physioweb series, Neurological Anatomy, Season 1. Let's begin with Series 2 and learn about vertebra and disc pathology. So, in that first we will focus on intervertebral disc. What is it made up of? So, disc basically consists of proteoglycans, water and collagen mainly. So, the inner portion, the central part of the disc is made up of nucleus pulposus, which is gel-like content, and it is typically made up of 70 to 90% water and by two types of collagen, type 1 and type 2, where type 2 will be mostly present in more amount. So type 2 collagen will predominate because it has to resist, that is this nucleus pulposus or the central part of the disc has to resist compressive force. So there is more of this water content, which is 70 to 90% water, and more of type 2 collagen along with type 1, but more there will be type 2 collagen to resist the compressive forces exerted on our spine or vertebra. Surrounding that we have annulus fibrosus, which is the outer part. It will have little less amount of water compared to the nucleus pulposus, which is 60 to 70% of water. So 60 to 70% of water is present in annulus fibrosus. There also we will see type 1 and type 2 collagen, but here type 1 collagen will predominate because this part will resist tensile forces or distractive forces. Nucleus pulposus was resisting compressive forces with more water content and with more type 2 collagen. Annulus fibrosus is resisting tensile forces with more type 1 collagen and less amount of water, that is 60 to 70% of water. Apart from this, there is also vertebral end plate at the end part of the disc. So this vertebral end plate contains proteoglycans, water and collagen like other part of disc, but additionally it has the cartilage. So vertebral end plate has additional cartilage present in it. So this was the composition of intervertebral disc: nucleus pulposus, annulus fibrosus and vertebral end plate. Now let's continue. Let's have a look at the vertebra and understand some basic parts so that later on we will see from where the spinal cord passes from the vertebra and also from where the spinal nerves are exiting exactly from this vertebra. So this is the superior view of vertebra. We can appreciate disc, nucleus pulposus and annulus fibrosus. And in this vertebral body, which is present anteriorly, we can find disc is present over there. Posteriorly, there are some processes, one of which, as we know, this is the spinous process. About all those parts or the general anatomy of this vertebra, we will discuss in detail about it in upcoming series. Now, just the gross things which will be important to understand this series. So considering that, we can see here there is vertebral foramen. This part, this gap in between is the vertebral foramen. So this is a single vertebra. It is having a foramen which is called vertebral foramen. Now there are two vertebrae over here in this lateral view. There are two vertebrae, one below the other. So in the center there will be intervertebral disc. Over here only the annulus fibrosus will be appreciated. And the other thing is that this red marked vertebral end plate can be appreciated. And one more thing, these are two vertebrae present over here. So here also there is a foramen, but it is present between two vertebrae. So it is called as intervertebral foramina. Here it was vertebral foramen, here it is intervertebral foramen. Now, based on this, we can understand that this central part is the vertebral foramen, and here there is the intervertebral foramen. From this vertebral foramen, we can see there is this spinal canal present from where the spinal cord will pass. So this over here also we can appreciate from this vertebral foramen upwards, there is a spinal canal. Upwards or downwards, there is the spinal canal from which the spinal cord will pass. So we can appreciate that. And similarly, we can see at this right side, this diagram we had seen earlier also, there is this portion of vertebral foramen which is occupied by spinal cord. So superiorly, upwards and downwards, there will be the spinal cord, and laterally there are those nerves emerging out of the spinal cord. So these are the spinal nerves. So now we exactly know from where the spinal cord and the spinal nerves emerge. So this part is basically clear. If we consider this as lumbar vertebra, there is disc in between and the anterior part, and posteriorly there is spinal cord which is traveling, coming from up to down. If in this diagram we can see from up, as it descends from the foramen magnum, it now crosses all the vertebra to pass down, and laterally it gives out these nerves which will innervate various body parts. So here there is this spinal cord, and laterally there are those spinal nerves. Now disc is over here. If there is some problem with this disc, if this content is pushing out, causing pressure or tension on the spinal cord or the nerves present over here, it will give certain symptoms. So let's understand about the disc pathology. So over here we can see the superior view of the vertebra. So we can appreciate there is disc, there may be bulging disc. So we can appreciate in the vertebral foramen there is this spinal cord, and laterally the nerve roots are emerging this way. So this is the bulging disc over here which may cause tension on the spinal cord. There may be protruding disc as shown below. This is the protruding disc. Or there may be herniated disc as shown over here. So there is herniation, that the part of disc, the part of nucleus pulposus we can see is coming out. The annulus fibrosus may rupture. We saw that the central portion was nucleus pulposus. Surrounding this there was this annulus fibrosus. If this is ruptured and the gel content from the middle is coming out, it may cause tension on the spinal cord, which we can see happening over here. So in those conditions, with those disc pathology, that is bulging disc, protruding disc or herniated disc, there may be impingement of nerves which may cause altered sensation in that particular part where this nerve root is going and innervating, or numbness or pain. For understanding this, we need to know about dermatome, which we will be discussing in upcoming series. But now we are just associating so that we come to know that we have to understand dermatome. Then only we will come to know which nerve root, like the problem is with which nerve root, which intervertebral disc is causing pressure on which nerve root, and hence we are getting to see those symptoms. Hence we need to know dermatome. As dermatome is a single nerve root innervating a part of skin, so that will form a dermatome. So which nerve root is supplying that part of skin which is having the problem, to find out that we need to know that dermatome. Like which nerve root supplies which part of the skin by number. Now let's see the disc pathology and involved nerve root. In previous series we saw from which vertebra, like from above the vertebra or from below the vertebra, the corresponding spinal nerve is emerging. Like suppose if we consider this diagram, if we consider C3 vertebra, so the C3 nerve root or C3 spinal nerve is arising above the C3 vertebra. If we consider L2 vertebra as this over here, then we know that L2 vertebra is here, but L2 nerve is coming out below the L2 vertebra. So from this we will come to know between which vertebra which nerve root is passing. And also disc is present between two vertebra, and the nerve is also present between two vertebra. So for example, if we consider L4 vertebra and L5 vertebra, so between that this disc will be present over here. Now if this disc between L4 and L5 has the pathology, it is either bulging, protruding or herniating, it will cause pressure or impingement of nerve roots over here at this region. And from here only there is nerve arising, which is L4 nerve, because as we know that below L4 vertebra, L4 nerve will be present. That means L4 nerve is between L4 and L5 vertebra. We can see L4 nerve is between L4 and L5 vertebra. So the disc between L4 and L5 is creating problem on these spinal nerves which are coming out from here, which is L4 nerve specifically. So disc between L4 and L5 vertebra is affected, will in turn cause problem with L4 nerve root. So we should know that where the disc pathology is, so that particular nerve root may get affected. So that we can come to an conclusion, as we will get to see certain symptoms. If there is altered sensations in that particular part which this particular nerve root is supplying, as in this case we considered that L4 nerve root is affected, so whatever part this L4 nerve root will be supplying, there the sensations may be altered, pain may be present or numbness may be present. Accordingly we will find out which nerve is involved. We'll come to know from that. For that we need to study dermatomes. Other than that, as we said, the topic is vertebra and disc pathology. So disc we considered, we discussed in detail. Now vertebra also may be the problem, the causative factor. Suppose there is positional change or subluxation of vertebra. This is the normal vertebra, this is the subluxed vertebra over here, the one which is star marked. This vertebra is subluxed posteriorly. So the nerve below it, this one, is impinged or is tensioned because of this subluxed vertebra. That nerve, the part of spinal cord over there, is entrapped because of this rotated or subluxed vertebra. This will be better understood in chiropractor terms, because the bony part is the problem over here. The vertebra itself has subluxated, which is tensioning the nerves, and this will give rise to neurological weakness. So similarly, as we saw the dermatomes, if we consider that this is the L2 vertebra, so the nerve, this nerve will be, below it will be L2 nerve root. And if this vertebra is subluxated posteriorly, then as shown over here, then this nerve, which is L2 nerve root, will be affected. So whatever part of the body, whatever muscles of the body this L2 nerve root will supply, that will cause the weakness of that particular muscle. So the patient will have problem in performing that particular movement. For that to understand, we need to know myotomes, that is which muscle is supplied by which nerve root. So where this nerve root is starting while emerging from the spinal cord, there the problem may be because of disc or because of vertebra. When it is because of vertebra, the myotome may be involved, which is causing neurological weakness. So if we test those myotomes, we will come to know which nerve root is exactly responsible for that. Hence, we need to understand dermatome and myotome. And also we came to know that disc can cause pain. Disc pathology can cause pain or altered sensations or numbness because the dermatome is involved in that part. But if there is neurological weakness, then the problem may be with the vertebra, where we need manipulation or mobilization of that particular vertebral region. If that is corrected, the entrapped nerve will have room as it was having previously and will function properly. And the neurological weakness will eventually subside. So, here in this manner, we can distinguish between the problems arising from the disc and the problems arising from the vertebral pathology. There is one more thing, facet joint syndrome. We will discuss about the certain topics which are linked with one another one by one in upcoming series. So for this series, this was it to understand about disc and vertebra pathology.